to the public. Do we have anyone? Seeing no one, we'll go right into our first agenda item. I would look for a motion to approve the contract renewal with Connie Brown for dietitian services in the WIC program and authorize the board chair to execute the contract.
I'll make the motion.
I'll support. Moved and supported.
Just real quick, contract renewal with a registered dietitian that we have on staff. We've had her now, this will probably be the 4th year. She does a good job for us, and so she works about 16 hours a week. So
okay.
She's a contractual employee in the WIC program. It's Women, Infant, and Children.
They only went up $1 from last year. So
$1
per hour.
Oh, okay. Yeah.
But at a limited number of hours, it's still within grades.
All right. Anything else? All those in favor signify by saying aye. Aye. All those opposed the same, and that will move to Wednesday. I would look for a motion to approve the contract renewal with Shiawassee Regional Service District for school nurse services in an amount not to exceed $1,170,000 and authorize the board chair to execute the contract.
I'll make the motion.
I'll support. Moved and supported.
Just the contract that we have with the RESD. This is the 3rd year that we've received the funding from the state. This is pass-through money from the CDC that goes to the state health department, and it funds grants to each school district in the county. That's 9 school districts. And we run the grant through the RESD because they have individual contracts with each school district. So we act as a fiduciary. The RESD kind of does all the back end work with the school districts, and then they just bill us. We increased the amount to each district this year by $10,000, so that the districts will be able to get up to $130,000 from the grant to pay for their nurse and then the indirect costs. Many of the school districts hire the nurse as an employee of the school district that carries benefits. Other districts choose to go with the contractual nurse, which is at a much higher salary, but then no benefits. So it's kind of what works for the school district. And as you know, this is one of my passions was to get school nurses. And so looking down the road, we're certainly hopeful that the state will maintain this funding once any of the federal funding goes away. And so that's down the road. But
You mean the grant's up 10,000 for each school?
Yeah.
Oh.
So this past year was 120,000. We moved it up to 130,000.
Oh, that's good.
And we are receiving from the state just under 1.5 million to administer this. So it's a huge program in our department. And as you know, a nurse is placed in each school district through this grant. So Morris gets the same nurse that Owasso gets. There's nothing based on the size of the district.
So Larry, so RESD gets a nurse.
RESD also gets a nurse because there's 8 districts and the RESD. So RESD also does get a nurse from this funding.
Right, and they already have a nurse. Right?
Yeah, they have a nurse separate from this position that
Okay.
they self-fund that. So.
Okay. Anything else on school nurses? All those in favor signify by saying aye.
Aye.
Aye. All those opposed the same. And so
I have
on.
to go. I gotta get to football practice.
All right, thank you.
You're playing football?
No,
Yeah.
my days are over, but I'm helping coach, trying to get it going. See you guys.
Good.
All right, thank you, Larry.
Good luck.
I would look for a motion to approve the request from SCOA for a 6.37% indirect rate until such time as their study is completed and new rate schedule is approved by the Board of Commissioners.
I'll make the support.
Moved and supported. I'll support that.
Couple of things. We're going to change that motion just a little, like accidentally used the one from the last time. But they're changing it from, so this all started several years ago now, where we started looking at what we could pay for and what we could not pay for. And we did an indirect rate study to see what is the opportunity cost that we're not capturing, that we're not reimbursing them for SCOA. And when we started the rate study, the individuals doing the rate study said that we could start with a de minimis 10%. And that's what the Board of Commissioners approved last time. So for everything that we get reimbursed for, or we reimburse them for every dollar, we were giving them an additional 10 cents for that administrative fee. So now that the rate study has come back, they have said that the rate should be 6.37%. So it's a slight decrease, but that is what they calculate as the actual cost that we're missing by not reimbursing for supplies related to using the building. That's their physical plant. And this will allow us to provide them that funding. And then their contract is up at the end of next year, so we will begin looking at a new contract in the beginning of 2025.
Okay. Do we have anything?
Do you guys have any questions about the decrease from 10 to 6.37?
Unless anybody else does, Gary, no?
That's what the firm came back
Yeah.
with. They're the one, they contracted with them to conduct the study, and so we don't pay a rental to use their building, but we pay for the lights. And, you know, we pay for the staff and so on and so forth, but we're not getting to that actual cost for the building for them, and this will help us do so.
Okay.
Yeah, we've been happy with the plan so far, so
Okay, good, yeah.
I don't have anything else.
All right, well, I just didn't want to ignore you
No,
guys over
you're
there,
fine.
So,
Thank you.
all right. If there's nothing else, all those in favor signify by saying aye.
Aye.
Aye. All those opposed, the same. And that will move to Wednesday. For our final item, I would look to approve the chairman's selection of Dawn Ritter to serve on the Shiawassee Health and Wellness Board.
I'll make the motion.
I'll support, moved and supported.
She's highly qualified.
Oh,
Yeah, I
Very
see
cool.
that. She really.
Yeah.
yeah.
She's a good addition.
Yep, I talked to her a little bit. I've known her not real well, but I think her letter speaks volumes. She'll really bring some good stuff to the board. So, all right. All those in favor signify by saying aye.
Aye.
Aye. All those opposed, the same. And that brings us to our second call to the public. All right, we are adjourned. Thank you.
I'll be right back.
Okay.
Meeting order. Please stand and rise for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. All right, that brings us to our first call to the public for the Economic and Physical Development Committee meeting. Hearing none, we'll move to Mr. P. Preston.
Thank you, Mr. Chair. Forgive my less than formal dress, we were training folks out in the field today, so I knew this was gonna be a light meeting, so I took advantage.
I'm deeply offended.
27 zoning permits, 28 monthly building permits. We had 4 new housing starts in the month of July. Code enforcement, we're in the process of restructuring and going to be bringing on some additional part-time staff, and that's part of the training today in the field, and hopefully we'll get that back up and going and get you folks reports on that. But otherwise, we are issuing tickets and we are out doing the public health safety violation first and foremost right now.
Okay,
Thank you.
questions? Thank you. All right, and because of our light agenda this month, we'll take the treasurer's report from Ms. Julie Sorensen.
Sure, good evening, everyone. Pretty busy in the office right now. Notices went out the 1st of August, letting folks with 2022 taxes owing know that there will be inspections starting in September. Inspections is really a kind of a bad term, I think, because people get that and they think, oh, somebody's going to come into my home and inspect. But it's really just somebody driving by the property. They take a picture, they make notes whether it's occupied or unoccupied, if it's in excellent or fair or poor condition, and just kind of general notes on the property. They'll knock on the door then. If somebody's home, they'll hand them the notice just to make sure they're aware. It's just one of those steps, letting them know the forfeiture process is happening and this needs to be taken care of before March 31st of next year or their home will be foreclosed. So this is just one of those steps again to make sure people are notified. If nobody is home, they would tape the notice to the door, or sometimes it's a vacant property, they'll tape it to a post on the property or whatever. It doesn't have to stay, the people can take it right down. It's not meant to stay there permanent by any means, it's just notification. So once those notices go out, our office gets real busy. The phone's ringing off the hook and people are coming in and they're getting those taxes taken care of or figuring out what they need to do. So that's a good thing. I did put in front of each of you tonight, our tax sale was last Friday, August 2nd. All of the properties sold. There weren't that many, but they all sold. You'll see the amounts. The minimum bid total amount was $39,707, and things sold for over $214,000. So a couple of the properties went for a little nice bids. The one property that's of somewhat interest is the one in Morris. That's the lot number 6205. Actually the village of Morris was able to purchase that at minimum bid, and that's one of the properties we're hoping through our blight elimination grant through the land bank, getting those funds to take care of that property. Hopefully that goes through as planned. that's the hopes. And besides that, we've got just an update on the dog licenses. We're at 3,617. I did notice on, Ryan, you printed that nice report last month, and we could see it declining, and it looked like it's been years since they did a census. That might be a horrible word, but I don't know if it's something for us to look into, if that would increase.
Yeah, and we have to do that 30 days before the 1st of December, I think. So we would have to start that this fall.
And I'm not sure how that works or what all it would entail, if it's something you would want to consider. It's just a thought to put out there, because back when we did it was like when the censuses were done, people were, I think, being maybe more honest and sticking with their licenses. Just a thought. That's about all I've got right now. Questions or?
If I could, so
Sure.
by census, that means a paid employee goes house to house looking for dogs?
Yeah, I'm not sure how that works. I remember years ago, and whether the townships were in charge of doing their own somebody from the township maybe. I remember years ago when it was done, but I'm not sure, Cindy. I'm not sure how that works. And
My
how-
guess is that that would be extremely unpopular, and I don't
And
know if it would be
I-
cost effective.
I agree, and it might be, people might feel unsafe going up to some homes.
Especially
Might
if they have a
not
dog.
want- Right. That was just something I noticed.
So-
And it is something that had been done in the past, but,
Any changes to fees that has to be done before, I think 30 days before December 1st. So if you're at all interested in doing any of that, looking at it, looking at the census, looking at the fees, the process, it has to occur this fall.
I'm certainly not, but
or next fall, maybe it doesn't happen this year, but I thought it might be something to think about, to consider.
Okay. Any other questions? Thank you very much.
Thank you.
All right, with that, we'll move to our first and only agenda item. I'd look for a motion to approve the L4029 2024 tax rate request as presented and instruct the chair and clerk to execute the same.
you gotta make the motion.
I'll make the motion.
And I'll support that. Discussion?
So this is to set the winter millage rates, and as you can see, our taxable value is about $2.5 billion. And then we look at the requested levy, the senior citizen millage, the medical care facility, MSU extension, veterans, PA 214, and then the veterans authorized. And you see the millage amounts listed there, and then you see the anticipated revenue as a result of those millages. So for example, if we look at the seniors and looking at what we were talking about in the previous meeting, they have a millage rate of 0.5, which would bring in about $1.2 million, which funds their operation. Medical care facility is 1.9679, which brings in about $5 million. MSU extension is 0.07, which brings in about $193,000. Veterans is 0.1 mils, which brings in about $254,000, and a veterans authorized is 0.1956, which brings in about $497,000.
Hasn't the veterans already got quite a bit in their savings account?
They do, but this is what we authorize every year, and they're spending it towards their veterans in need in their program.
So, Dr. Buggs, the peacetime is the PA 214, or is that the wartime?
I believe PA 214 is the peacetime one.
Okay. That's all I had. I know our wartime veterans seem to be not.
I believe the wartime one is the authorized one, because the authorized millage is something the board can set. Though PA 214, I believe, is voted in by, on the ballot. And we put that up last year.
Okay.
Okay. Further discussion? Hearing none, all in favor of moving this on to Wednesday, please signify by saying aye. Aye. Those opposed? All right, we'll see you Wednesday. That brings us to our second call to the public. Hearing none, this meeting is adjourned. Thank you very much.